Good day, everyone. We are the Group 6, and I'm the first reporter. And we were gonna tackle about demonstrate deep knowledge about hearing impairment. Metalanguage. First is impairment. So, what is impairment? Impairment is any loss or absence or abnormality of psychological. Examples of psychological is depression, bipolar behavior, schizophrenia, and next is physiological or anatomical structure of function. So, nadiri naka-inline is ang deafness, blindness, and such. Then, prelingual hearing impairment. When we say prelingual hearing impairment is lost hearing before speech. So, meaning ana is nawala na ang imuhang ability to hear before ka makastorya. Example ana is kanang inborn na deaf. Example na siya sa prelingual hearing impairment. Then, next is postlingual hearing impairment. When we say postlingual hearing impairment, lost hearing after spontaneous speech. When we say after is kanang na siya makastorya na siya before siya na wala nawad-an og hearing ability. Example ana is ang example ang babae na disgrasya and then naapektuhan iyang dalunggan, so mo nang nag-cause siya og nawala iyang ability to hear, so postlingual hearing impairment na siya. When we say noise naman, noise is unwanted sound. Morning familiar sa tuwa, diba, when mag-online class ta kay na mga video kay sa silingan, mga sakyanan kasaba sa inyo balay, mao na siyang noise. So, next, Hellen Keller. Who is Hellen Keller? Hellen Keller is both deaf and blind. So, imagine both deaf and blind. So, ngano kaha siya na himong deaf and blind? So, when she was just 19 months old, na ay unknown disease ang cause sa iya to lose her hearing and sight. And Keller was born in Tuscumbia, Alabama on June 27, 1880. So, nang dahil dyan, her parents enroll her or giadto siya sa doctor, which is si Julian John Fisolm, and professor of disease of the eye and ear at the University of Maryland. So, nag-meet adto sa parents ni Hellen Keller, si Hellen Keller kay Julian John Fisolm. And gi-recommend ni Julian John Fisolm na na-meet si Abraham Graham Bell. Abraham Graham Bell is a known inventor for he is the first nagkuan sa telephone. So, first practical telephone. And then, ngano ipamit siya kay si Alexander Graham Bell is iyang wife is deaf, so moto siya. So moto gi-enroll si Hellen Keller sa iyang parents at Perkins Institute for the Blind and met Anne Sullivan. So si Anne Sullivan is mentored by Alexander Graham Bell. So as tigawang si Hellen Keller is kauban na niya perminti si Anne Sullivan. Then, so when she grew old, si Helen Keller, she fell in love with her secretary, not permanent secretary but temporary secretary, si Peter Fagan. So they were both in love, and then nagplano sila na magpakasal and even prepare the documents, pero nalaman sa parents ni Helen Keller, and then gi-stop ang ilahang plan na magpakasal. So walay nadayon nakasal. Then Helen Keller was a member of Social Party of America and was a vaudevillian, 8 Wonders of the World. So, meaning si Helen Keller og si Suvillan, niadto sila town to town to share the life of Helen Keller and to inspire siguro sa mga tao dito. And then they speak about her life, and si Sullivan ang mag-translate para masabtan sa ubang tao, and then naaya po'y Q&A mahitabo, and then ginatawag siya sa mga tao as brightest star of happiness and optimism. So 8 wonder of the world. Then traveled the world to advocate for people with disability. So si Helen Keller is globe-trotter. When we say globe-trotter is nag-travel na sa different countries or different parts of the world. So imagine 39 countries ang giadtuan ni Helen Keller o Sullivan to advocate para sa education sa mga blind or deaf or disabled person. So siya ang nag-advocate na dapat paskilahon ang mga tao na nainani ng mga conditions. And then she met presidents, prime ministers, and other government leaders. So imagine inani siya ka-productive even having this kind of situation, even deaf o blind siya. Lisod kayo magpiyong ka niya, bungol pa ka, wakay mastorya. So grabe siya ka, amazing na person. So Helen Keller died at the age of 87. So natural cause on June 1, 1968 in Easton, Connecticut. So this is Helen Keller. Oh, na siya na-meet. I don't know if this is a president or prime minister, pero sure ko na government official na siya. Hearing, made possible through the collection of sound waves, changed to vibrations, and conducted as impulses to the brain. So, when we say hearing, is kanang makadungog ta. Ang dungag information, ang kalayan sa hearing and listening is hearing, nakadungog lang ka. Pero wala ka naghatag og attention sa imuhang nadunggan na sounds. And pag listening is nakadungog ka and nagpay attention ka sa imong nadunggan o nasabtan nimo ang sound na imong nadunggan. Then ear. We all know the ear is the organ of hearing and balance in humans and other vertebrates, especially the external part of this. External part sa atong ear is kaning normally na atong nagunitan adlaw o nakita nato adlaw. So there are more parts of the ear. Parts of the ear: first, external, responsible for conducting sound waves. Mo ni katong gingon makitaan og magunitan nato every day. And middle, closed chamber behind the eardrums that transmits sounds to the inner ear. And inner contains sound receptors in the form of microscopic hair cells that are bathed in a liquid. Movement of the ossicles stimulate the hair cells, which in turn activate the hearing nerve endings that send an electric impulse to the brain. So, mao ni siya ang external part na akong giingon na magunita na to everyday, and mao ni diri atong ginalimpyuhan everyday. And mao ni siya ang inner part na auditory ossicles, na malleus, incus strips, and ang eardrum is iyang laing term is tympanic membrane, and iyang inner ear is the semicircular canals. So mo ni siya facial nerve o vestibule I don't know how to pronounce. Then types of hearing impairment. Conductive hearing loss is decrease in the sound caused by a problem in the outer or middle ear. Siguro ang problema sa iyang outer, sa iyang eardrum, or sa iyang external canal na siguro yung nagbara or something, or sa na guba na nerve, or sensorineural hearing loss, problem located in the inner ear or along the nerve pathway between the inner ear and the brain. Then auditory neuropathy, there's a problem with the auditory nerve transmitting the signal from the cochlea to the brain. So kaning kay nerve na connected to the brain na mag-transmit na information na itong madunggan o mixed hearing loss, conductive and sensorineural loss occurring at the same time. So ang mix kay kaning duha na problem kay present, morning ginatawag siya na mixed hearing loss. Characteristics of persons with hearing impairment. So muffing of speech. So when we say muffing of speech is kanang magstorya siya pero murag gitabunan ang iyang babag sa inana ang muffing of speech. So difficulty understanding the word, frequently asking others to speak more slowly and clearly and loudly, so needing to turn up the volume of the television or radio. Dili siya kadungog kung hinay kayo dapat kusgan og maayo withdrawal from conversation, kanang sigurong magstorya mo niya mukalit na siya gawa kay murag maglisod siya o communicate sa imuha. Avoidance of social settings. So kani example sa mga hearing aids, even ang bata magsuot og mga hearing aids, kani siya kay mahal kay siya na hearing aid, mo nang dili basta-basta ang mga tao na inani na situation. So the next reporter is GULTIANO.
Good day everyone, I'm Jennifer H. GULTIANO, and for today's video, or for today's topic, we're going to discuss about common causes of hearing loss. So the previous reporter discussed about what are the parts of our ears, and what are the functions, and also the impairment. So for today, we're going to discuss again common causes of hearing loss. Next. So one of the main reason and one of the causes of the hearing loss is, first we have the congenital or genetics. Hearing impairment was already present at birth. and it's hereditary and non-hereditary genetic factors. So it may be like from our parents, it's hereditary, and it's not it's non-hereditary. So we will going to acquire. Because when the mother having a child or fetus on the womb, if that fetus has a damaged bone, it could be or it will lead to the child to have a hearing loss. So next, jaundice. So for this one, it's a yellowing of a baby skin. It's a disorder or has a yellow skin type, and also the eyes, and have a high level of bilirubin. And the newborns still developing liver may not be mature enough to remove bilirubin. So this jaundice eventually when a child has a jaundice, actually it will remove as time goes by, but will take time to like remove it. Bilirubin, which is the main cause why a child has a jaundice. So once the liver will be developed, the bilirubin will remove, and the jaundice will remove also. So the child will not be like have a yellowish or yellowing color or skin type, and also the eyes of the child of the newborn child, and normally it will remove like or disappear within 2 to 3 weeks. It depends on the newborn baby. Okay, so additionally, high levels of bilirubin can put a baby at risk of for deafness, cerebral palsy, or other forms of brain damage. So should not like this jaundice disorder or this disease. It's a very dangerous when it comes to the newborn child or newborn babies, because as we all know that babies are not that have much like a resistance, or like they are not that have a level a total high level of a good immune system. So next we have middle ear infection. As you can see on this picture on the left side, this is the illustration of a normal middle ear. So we have the eardrum and the auditory bones and the eustachian tube. So this is the eustachian tube. So when a person has a middle ear infection, so this is the infected area on the middle ear. On the middle ear. So this is the yellow part. So as you can see on the yellow part, on the right side of the picture, it shows the yellow part. It's the infected fluid on the middle ear. Okay. So yeah, that is the one of the causes of hearing loss. Next, we have illnesses. So we have mumps. On the left side of the picture, you can see the healthy child without mumps. So on the right side, we have the child with mumps. So um, it's a disorder or illness of a child, commonly in the child, that it will the child will have a bigger on the other side of the jaw, left, it's either left or right jaw part of the face of a child. So next we have the rubella German missiles or missiles, I don't know. So we have the rubella rash. So normally, the child, if a child has a rubella missiles, we the child will affect the hearing loss of the child. Okay, so the symptoms are the redness of the body or all over the face and the body of a child. So next we have meningitis. It's a bacteria. It's an illness that which affects the brain of a child or a human. So as you can see on the left side of the picture, this is the normal brain. So if a brain has infected or have the bacterial meningitis, this is the outcome. So this is the infected, or this is the bacterial meningitis. It's the illness of the brain. So there is a bacteria on our brain. So next we have aging. One of the main causes of hearing loss is the aging. As time goes by, a person from child to adult, the person develop right the physical, the emotional, or the mental aspect of a human body will have a development. But when the time that a person will going to be on the adult stage, wherein around 70s or 60 plus, or like a senior citizen, most of our grandmother or grandfather will have they have a hard time to hear us, right? So yeah, one of the causes of hearing loss is aging. So next we have the major infections. So these are, as you can see at the pie graph, it shows the most or the major infections that a person will experience. So first we have on the blue color side, we have the malaria. Next, on the maroon color, we have tuberculosis. So it's very common, right? Next, we have dengue. On the green, dark green side, next we have the leishmaniasis. On the purple or darker color of violet. And next, we have the hepatitis. We have the A and B. So yeah, it's a infections of the liver. So next we have the pneumonia. It's very common. And next we have shigellosis. Next we have measles. Next we have yellow fever. Next we have typhoid. When we say about the leishmaniasis, it is a parasitic disease that is found in parts of the tropics, subtropics, and southern Europe. So also, this leishmaniasis is caused by infection with the leishmania
So,
parasite.
when we say about the leishmaniasis of the tropics, neglect, and southern
With
with the leishmania parasites.
flat
So, it is spread by the bite of
it
phlebotomines and
causes
flies. So, yeah, it causes for the leishmaniasis. It's the infection of the bites of the sand flies,
which
which that can produce
parasitic
parasitic
like
like
so.
disease. So
Next we have
next we
the
have the when we say about the
shigella.
shigellosis, it's a bacteria. It's a non-spore forming in a rod shape and genetically close to related to E. coli. Next, we have the typhoid. So, it's a bacterial infection that can lead to a higher fever, diarrhea, and vomiting. So, it can be fatal and it is caused by the bacteria of Salmonella typhi or typhi. So, we get the typhoid infection through contaminated food and drinking water. So this
I
is
can say
the
infectious
dangerous
diseases. We have
infectious diseases. Infectious diseases we have, yeah,
the cholera,
the meningococcus,
smallpox,
the
malaria,
cholera, the plague, the
tuberculosis,
tularemia,
virus,
smallpox,
anthrax, rabies is
malaria,
the causes or the
AIDS,
agents that
tuberculosis,
causes a
Ebola
person
virus. Too
exposed
much
to
exposure of
very
loud noise. It's
really
like we
due
all
to
know that too much
damage. So
can be
using
very
too much
dangerous
use
in
of
our in all aspect, right?
earphone,
So
yeah,
when your ear is
it's
experiencing
very
or like
dangerous.
exposed to
Exposure of loud noise. Next, we have the head injury or trauma.
very loud
So,
noise,
if
it
our
will lead
brain or
you
head
to have a hearing loss
have
also, like
like
using too much use of the headphones or
it
earphones.
affected
Yeah,
our ears.
it's very dangerous
Yeah,
when it comes
should
to
be
exposure
careful.
of the loud noise. Next, we have
Should
the head injury or
so
trauma.
most
So, if
main
our brain or
the
head
main
will
like the
have
this major part of our body
like
that has
um like an
function
injury or
is
trauma,
our
it will be
it's very
affected.
important to
Our
be
ears will
more
be
careful. So
affected.
next we have
So
exposure to
as we all know that ears is connected to our
and
brain.
have
So yeah,
damaged ears. So we
should
have
be
the
careful,
early
especially in your head.
message
So
hearing
most
using
the main or like
so
the
function
of our
and
body that
structure.
has a
And
major
next we have
function,
Gertex.
it's our
Gertex
brain. So it's very important to to be more
if the
careful.
Gertex
Okay, so next
will
we have
use
exposure to chemicals or
the
medications
athletes
that damage the ears. So we have the
and also
anti-inflammatory such as ibuprofen or naproxen.
this is
Then next we
aspirin,
have Zyrtec. Zyrtec,
Tylenol.
it's the Bumix
Yeah,
and
next
the
we have the
cream. You can
anti-medications
use the
that
Zyrtec. It's a water pill,
so this
commonly used
medication
by the
we have
like
the
the athletes.
potential
Mm,
impact which is
and
pitocin that
also
could lead
Zyrtec.
to
Okay, next we have the pain
next we
relievers
have the degree
such as
of hearing
aspirin
loss.
and
We have a mild
Tylenol. So yeah, next we
hearing
have the cancer medication,
so
ciplatin and carboplatin. So
um
this
the
medication, we have the
mild
potential impact,
like
which is the
um
toxic that could lead to hearing loss. Next,
specific
we have
like
the degree of
moderate
hearing loss. We have a mild
has a difficulty
difficulty
when it comes to
hearing
vowel sound
soft-spoken people. So,
sounds.
um,
Next we
for
have
the degree of
severe.
hearing loss, we have the
It's
mild.
the
You cannot
speech
like
is
um,
audible without
hear
aids or
from the
ocular.
soft-spoken people. So next we have
It's
moderate.
ocular
It has a difficulty when it
implants.
comes
So
hearing
when
vowel
it
sounds and
comes
missing
to
consonant sounds.
the
Next, we have severe.
severe,
It's the speech
it
is
should have
unaudible
they
without
have a
hearing
hard
aids
time
or cochlear.
like
We call
hear
this
anymore. So
cochlear
they have to wear
implant. So when
or cochlear
it should
implants.
have
So next we have
they have a
it's the
hard
very
time
loud
to
sounds
like
such as
hear
airplanes,
anymore. So they
air,
have to wear hearing
can't
aids
be here without
or cochlear implants. So next, profound, it's the
we
very
all
loud
know that
sound,
when we
such as airplanes, engines, and fire. Alarms
sound
can't be heard
very
without hearing aids. So
so
airplane
people
sounds or
has
the engine
a
sounds, it's
hearing loss
very
of
loud.
hearing loss
So with the people who has a hearing
more.
loss or
So
with a
it
degree hearing loss of
used
profound, they cannot hear
like
anymore. So
hearing
they should use like hearing aids so that they could hear
to
it. So like
have
it's very
like
difficult
the
to
most loud
have a hearing loss. It's like
long
the most loud noise. We cannot
now
longer hear that.
the
So
formal
next we have
the
the informal hearing
uh,
test. We
have
have the
for
test
or for detect
for having the or for
test
detecting the hearing loss. We have the whisper test.
have all
Next, we have
test
the ball pen clicking
rather we
test.
have the conversation
Test rather, we have the conversational line voice
so
test. So yeah,
let's go back to the conversational line voice test
so
which
let's
is
go back to the
it will test the speech test
conversational
of a
line voice
person
test,
of
which is it will
this
test
is the
the speech
speech test
test of a person,
test
of
of
a
all
child.
and speech
So
also
this is the
involves
simplest
words without
test of
any
all
additional
when it comes
information
to hearing loss.
and
So it involves the
we
test.
five words loudly at lasting ability to hear words without using any visual information. And patients should only repeat 5 words spoken loudly at a distance of approximately 5 meters. The whispered voice test involves the tester blocking one patient's ears and testing hearing by whispering words at varying volumes. So it's a test wherein um, like it has a level of varying volumes so that a person could test how how high or low the level of the um of the hearing loss. So we should this test determines if it's the condition of the hearing loss. It's mild or it's profound. Okay, so next we have the common disorder associated with hearing loss. So one of the major common disorder we have the fistula. It's the hole or rupture of the oval or round window on the inner ear, mainly perilymph into the middle ear. So this is the picture shows right here it's the infected fistula disease. So or disorder. So as you can see, if a mom or if a mother has a baby on her womb, this area it's the red line. It's the areas fistula are commonly occurs. So, as you can see, the baby is placed, or the head of the baby is placed on the area where it has a fistula infected or infected area. So most likely, the child will have a risk or have a greater chance to have a hearing loss because of the fistula disorder. Next, we have the meningitis. Again, it's the neonatal infection, which serves as common cause of acquired sensorineural hearing loss. It's the one of the major disorders that could lead to hearing loss. Next, we have the Usher syndrome. It's the autosomal recessive disorder, which in 6 to 12% of congenitally deaf children and 3 in 100,000 of the general population has this Usher syndrome. We have the type 1. It's the patient with a type 1 Usher syndrome experiences profound deafness in both ears and severe balance problems at birth. Problems with vision typically begin in early childhood. So it begins with in birth of the child or at birth, and also it begins with the early childhood of having this type 1 Usher syndrome has a deafness and like a vision problems with vision. Next, we have type 2 hearing loss in patients with type 2 Usher syndrome varies from moderate to severe at the time of birth. Patients usually do not encounter vision problems until their teenage years. So, for the type 2, it will, as the time goes by, if a child has a moderate to severe, like having a deafness, the child has no problem with the vision. But eventually, as a child develops the body, the physical features when it comes to the stage of teenage years, it will it will have or it will appear the vision problems. So next we have type 3. Patients with type 3 Usher syndrome are born with normal hearing and balance and do not encounter problems until puberty. Vision problems are common and progressive. So when it comes to the type 3, it's
The line
not it's
it's
normal.
hard to
When a
secure
child was born, it's normal.
lens
So but by the time goes by, the
approach
the child or the
without
person will encounter the vision problems. Will
not the
eventually
line disease. It's the acquired disorder caused by TB, which
like aging, like
is
it will reflect or will eventually
progress
appear
for adults.
when a person is
Um,
like
it's rare
comes in the
dangerous a um,
stage wherein
a
it
sex
is adulthood. Okay.
bacteria.
So
The
next we have
bacteria eventually
the next
spread
we have
on
the Lyme
our blood
disease. Hold on.
our body, our brain,
It's
blood. So
incorrect.
it develops bacteria. So it's very dangerous to have or like to have type of particular um insect like a lice or yeah, lice or poodle or the dogs. So we should be more careful, okay? So that is a common hearing problems or that is the common causes of having hearing loss.